The elements for BLS is the airway, breathing, and circulation, also known as the ABCs. A BLS provider is not authorized to perform invasive procedures and may only administer a few selection of medications. An ALS provider performs invasive procedures and administers a wide array of medications. A BLS unit includes 2 EMTs, while an ALS unit also has 1 paramedic. Alright, so the use for an AED is if a CPR ain't working, then switch to an AED, and you can run into things like if the patient has a heavy chest, or if the individual is found underwater, or if the victim has a pacemaker or an implantable defibrillator.
2, 1. Alright, the goal of CPR is to keep O2 flowing in the lungs and keep the body oxygenated. Also, to restore breathing and circulation. However, advanced interventions and defibrillation may be needed to achieve this goal. In order for CPR to be effective, you must quickly be able to identify when a patient is in respiratory or cardiac arrest. And CPR should only be performed on a patient in cardiac or respiratory arrest, also if a patient cannot breathe.
Cardiopulmonary resuscitation, CPR, is a critical emergency procedure used to maintain blood flow and oxygen in a person's experiencing cardiac arrest. CPR includes chest compressions and rescue breaths, but it also helps maintain the blood circulation while rescue breaths deliver the oxygen to the victim's lungs. The American Heart Association chain of survival consists of 5 critical links aimed at maximizing the survival of patients experiencing cardiac arrest. The first link involves recognizing the emergency and activating the emergency response system promptly, and also that they are trained medical professions are dispatched quickly. They are also known as recognition and activation of emergency response system. The second link emphasizes the importance of early cardiopulmonary CPR by trained by bystanders, which helps maintain blood circulation and oxygenated until professional help arrives, and also known as immediate high quality CPR. The third link focuses on rapid defibrillation using automated external defibrillators, AED, to restore a normal heart rhythm in cases of ventricular defibrillation or pulses ventricular Alright. The fourth link involves advanced life support provided by healthcare professionals who can administer medications and advanced intervene to further support the patient's chances of survival. Basic and advanced emergency medical services is what they're called. So the last one is advanced life support and post-surgery care. It's providing care for life-threatening emergencies such as cardiac arrest, severe trauma, or respiratory failure. ALS is a high-trained healthcare for paramedics. And also, if you have recovery, emotional, it takes a year or longer who also had a cardiac arrest. By interrogating these 5 links chains of the survival significantly improves the likelihood of survival of the cardiac arrest patients by ensuring timely, intervene continuously care and assessing the life-saving measures at early stages of emergency.
Okay, my answer for the knowledge objective is describe the signs and symptoms of including compensated and decompensated shock, and then give you the definition for both of them. The early stage of shock, in the early stage of shock, while the body can still compensate for the blood loss, is called compensated shock. In the late stage, when the blood pressure is failing and the mental status is declining, it's called decompensated shock. Another sign for decompensated shock is cold, clammy extremities, a feeble and absent peripheral pulse, severe tachycardia, and bradycardia in late shock. As for compensated shock, compensated, there will be elevated heart rate, systolic blood pressure over 90, a normal mental status. Compensated shock usually may not have no symptoms. Some patients feel palpitations like a shortness of breath, fatigue over non-specific and vague symptoms.
Yeah, ready? 3, 2, 1. See safety BSI. Sir, can you hear me? Sir. I have a light pulse. I have a light pulse at his radio. I'm gonna start chest compression.
So you do 30 chest compressions with 2 respiratory breaths.
30. Keep going. I did 30. I need you to get me a mask. Alright, and we're not doing mouth to mouth because he may have AIDS. So, do 1, 2. Now I'm gonna do chest compressions again. I'm gonna do 2 more breaths and he should be awake. 1, 2.
He's good.
Good morning, sir.
Alright. That's good.
Stop it.